4,000 years ago, someone opened up a living human skull, exposed the brain underneath, and the patient walked away afterward. No anesthesia, no antibiotics, no idea that germs existed. And the strangest part isn't that they attempted it. It's that we have proof some of them didn't just survive the surgery, they survived it for years. Today you're going to find out how ancient Egyptians figured out how to operate on the human brain thousands of years before we had any of the tools modern surgeons consider essential. And why the way they used this knowledge says something unsettling about how medicine actually advances. Stick around because the ending of this connects directly to something happening in hospitals right now. Picture this. You live in ancient Egypt. You get hit in the head in a fight, or you fall off a roof while building someone's house. You survive the impact, but something's wrong. You're dizzy. Your vision blurs on one side. Maybe your arm won't move right anymore. There's no hospital, no X-ray, no way to look inside your own skull and see what's actually damaged. All the healer treating you has are their hands, their eyes, and whatever the people before them managed to figure out through trial and error. This is the exact situation that forced ancient Egyptian physicians to become something history barely gives them credit for. Not mystics, not priests waving incense over a wound. Actual clinicians making careful observations about the human body, writing them down and passing them on. And the proof of that is a document that, when it was finally translated in the 1930s, shocked modern doctors. It's called the Edwin Smith Surgical Papyrus, named after the American who bought it in Egypt in 1862. The text itself is even older than that purchase, believed to be a copy of a document written around 1600 BCE, possibly based on material centuries older than that. Here's why this papyrus matters more than almost anything else in ancient medical history. It contains the earliest known written use of the word brain in any human language on Earth. Think about that. Before this document, there is no known record of a human civilization writing down the concept of a brain as an organ with a function. The papyrus documents 48 real medical cases: head trauma, spinal cord injuries, skull fractures. And it doesn't read like magic or superstition. It reads like a clinical case file. Symptom, diagnosis, treatment, prognosis. For some cases, the physician writes something startling. They classify certain injuries as an ailment not to be treated. Not because they didn't care, because they understood correctly that some injuries were beyond what they could fix, and they were honest about it instead of pretending otherwise. That's not primitive thinking. That's the same triage logic an ER doctor uses today. Now here's where it gets physical. The procedure is called trepanation, cutting or scraping a hole directly into the skull to expose the brain's outer surface. It's important to get this part right because it's often exaggerated online. Trepanation in ancient Egypt was actually rare, especially compared to places like ancient Peru, where thousands of trepanned skulls have been found. Egyptian physicians, based on what the Edwin Smith Papyrus tells us, generally preferred to avoid operating on the head unless it was absolutely necessary. But when they did operate, the evidence shows real skill. One of the clearest examples comes from a skull found at Qau, dating back to Egypt's Old Kingdom period, somewhere around 2181 to 2160 BCE. Researchers found a deliberately made hole in the frontal bone, and the surrounding bone showed clear signs of healing. That means the person didn't just survive the operation itself. They lived long enough afterward for their body to start regenerating bone around the wound. An even more dramatic case comes from a mummy linked to a man named Jedhor from Egypt's 26th dynasty. A CT scan in 2006, decades after the mummy was first examined, revealed a surgical opening in the top of his skull measuring roughly 53 by 43 millimeters. That's not a small test incision. That's one of the boldest skull surgeries ever documented from ancient Egypt, using a blade made of flint or sharpened metal and nothing to numb the pain beyond herbal remedies or alcohol. Someone cut through skin, muscle, and bone. then stopped precisely at the surface of the brain without killing the patient in the process. Here's the part that should really mess with your head. They didn't understand bacteria. They didn't understand that unclean tools could kill a patient just as easily as the injury itself. And yet, skull after skull shows bone regrowth, which is undeniable physical proof of survival. So how does a surgery succeed without any of the science we consider essential today? Partly it's technique refined over generations. Partly it's that the human body is more resilient than we give it credit for. But there's another explanation that's easy to miss. Some of these surgeries weren't guesswork. They were targeted responses to real, visible problems, like relieving dangerous pressure from swelling or bleeding under the skull after a head injury. Even without knowing the biological mechanism, if you consistently see that letting pressure out helps some patients recover, you learn to repeat what works. They were pattern matching their way toward real medicine, without the underlying science to explain why the pattern worked. That's not luck. That's an early form of the scientific method, running on pure observation instead of a hospital lab. Here's the detail that makes this story more disturbing than impressive. Ancient Egyptian medicine wasn't purely clinical. It existed alongside religion and magic. The same physicians documenting precise, rational case studies in the Edwin Smith Papyrus would also use spells and appeals to the gods in other medical texts, especially for illnesses they couldn't explain physically. So picture the same healer standing over you. In one hand, careful clinical judgment built from real observation. In the other, a belief that evil spirits could be trapped inside your skull and needed a way out. Both of these ideas lived in the same mind at the same time without contradiction. And weirdly, that combination might be exactly why they succeeded as often as they did. The clinical caution from the papyrus meant they usually avoided unnecessary surgery, which alone would have saved lives. But when a surgery was clearly needed, the same culture also had generations of hands-on surgical experience to draw from. They didn't need to fully understand the human brain to develop a working relationship with it. So next time you get a headache and reach for a pill without thinking twice, remember what that exact problem used to cost someone 4,000 years ago. It used to cost a blade against bone, and a physician who might not know exactly why the procedure worked, only that sometimes it did. We like to imagine medical progress as this clean, upward staircase. Someone discovers the science first, then applies it safely. But that's not how it happened, not in ancient Egypt, and not really today either. Vaccines were used successfully before anyone understood what a virus actually was. Doctors adopted hand-washing to save lives decades before germ theory was proven, and the physician who figured it out was mocked for it at the time. We're still discovering how many drugs we prescribe every day actually work at a molecular level, long after they were already approved and saving lives. The Egyptian healer cutting into a skull 4,000 years ago and the modern surgeon in an operating room today aren't as far apart as we like to believe. Both are working the exact same way. Try, observe carefully, refine, repeat. We didn't get modern medicine because someone was born understanding the human body completely. We got it because people kept cutting into the unknown and writing down exactly what they saw until enough of it added up to something we now call science. And the unsettling part is, we're still doing that right now. We're just better at hiding how much of it is still educated guesswork.